We're here to talk a little bit about prescription drug abuse, specifically amongst teenagers and youth. I'll start off by defining a few terms that you're going to be hearing throughout the presentation. We'll start off with what a prescription drug is. Prescription drug is a drug that can be dispensed to the public, but only with an order given by a properly authorized person, so particularly a physician or a prescriber of some sort. Prescription drug abuse, essentially what that means is taking prescription medication that's not prescribed for you, taking it for reasons or in dosages other than what they are prescribed for, which can oftentimes result in serious health effects and addiction. Some of the commonly abused classes of prescription medications, we have opioids. These are used for pain. They're considered central nervous system depressants, or what they call downers. So some of the opioids that you'll be hearing me talk about, we have hydrocodone, known as Vicodin, oxycodone or OxyContin, propoxyphene or Darvon, and hydromorphone or Dilaudid. Some other depressants that are used to treat anxiety and sleep disorders are benzodiazepines, also known as diazepam or alprazolam, and some stimulants used to treat ADHD or narcolepsy. Some interesting and alarming statistics and trends. In 2009, it was reported that 16 million Americans aged 12 and older had actually taken prescription pain relievers, tranquilizers, stimulants, or sedatives for non-medical purposes at least once in the year prior to being surveyed. So we'll walk through some categories, some of the names of these substances, some commercial names, the routes of administration, and the street names that you might hear your teenagers or the youth use, whether in text messages, on the phones with their friends, or otherwise. We'll start with the benzodiazepines, Ativan, Halcion, Librium, Valium, Xanax, and you can read the list in the center category there. Some of the street names associated with these are Candy, downers, sleeping pills, or trinks. Other sleep medication that can be used for abuse and addiction are Ambien, Sonata, and Lunesta. And either one of these can be swallowed, routes of administration. Some of the intoxication effects of these drugs: sedation, drowsiness, reduced anxiety, so they use this to calm their nerves down, whether it's before an exam or any kind of stressful situation. Feelings of well-being, lowered inhibitions, slurred speech, poor concentration, confusion, dizziness, and impaired coordination and memory. Oftentimes, if and when these are used with alcohol, can result in respiratory distress and death. The next category that we're going to talk about are the opioids. The mechanism of action for these drugs are they activate the opiate receptors in the brain, which produces euphoria and pain relief. Codeine, one that I think most of us are familiar with, Amperin with codeine, Furanol with codeine, Robitussin with codeine. Some of the street names in this category, they'll call them Captain Cody, Cody, Schoolboy. We'll go on to the morphine and the OxyContin. The commercial names for these drugs are Roxanol, Duramorph, or Oxycodone. Street names for these are M, Miss Emma, Monkey, White Stuff. For Oxycodone, they'll call it the love drug or the love hormone, because what ends up happening is it'll allow them to build trust in each other, and then they'll develop relationships based on that. With overdose for morphine, you'll find the blue pigmentation in the fingernails, the lips, or the skin of whomever is using it. Overdose for OxyContin will be cold skin. And there are several others that you can see on this list here. Vicodin, I think most of us are familiar with Vicodin. Signs and symptoms of abuse with Vicodin are paranoia, severe mood swings, and the severity of this is that the majority of these drugs are found in the medicine cabinets. So whether it's the parents, the aunts, the uncles, the grandparents that are using this medication to help them with pain, to help them with sleep, they're in the medicine cabinets. And so the youth will find very easy access to these meds and be able to use them to get the benefits that they're looking for. Next category that we're going to talk about here are the stimulants. Mechanism of action for these are they increase the levels of dopamine in the brain. It's a chemical that's associated with feelings of pleasure as well as attention. So we have amphetamines, what were commonly known as Adderall. These can be injected, swallowed, smoked, or snorted. And some of the street names of these are beanies, black beauties, crosses, hearts, LA turnaround, speed, truck drivers, or uppers. And as mentioned, these will stimulate the individual taking them, whether used for prescription purposes or used for non-prescription purposes for abuse. Then we have the methylphenidate, the Concerta, and the Ritalin. Oftentimes, these are used to treat young children for ADHD. The intoxication effects that we would need to be aware of are feelings of exhilaration, increased energy, and increased mental alertness. The potential health consequences: increased heart rate, blood pressure, metabolism, reduced appetite. There's weight loss, nervousness, insomnia, seizures, heart attacks, and stroke for any abuse of these drugs. I would like to note here that if and when they're taken in the therapeutic doses, the effects of the stimulant is achieved by a slow and steady increase of the dopamine. And so it increases those levels in a way similar to that natural production of the body. So there's no severity or danger as long as there is a prescriber that's authorizing and monitoring. I'll go through some facts about prescription drug abuse here. About 7 million Americans reported past month use of prescription drugs for non-medical purposes. And that was a study from 2010. You look at the next slide, a little bit alarming. It shows drug abuse amongst 12th graders just in 2010. After marijuana, prescription and non-medical use of over-the-counter meds account for most of the commonly abused drugs in youth in our society. Very alarming. So some of the physical signs and symptoms that parents might find with their children abusing drugs, prescription drugs particularly, because there are so many different types, and it goes anywhere from stimulants to painkillers to antidepressants that are being abused, oftentimes it's difficult to find signs or symptoms to look out for. Each drug has its different effects, and what they do is they will mix these drugs. They'll find them at farming or bowling parties where they'll mix the medication and combine it with alcohol. And so the effects of permanent organ damage and death are very severe in these situations. They'll crush them, they'll snort them, they'll inject them, and by doing so, they're going to get a much quicker and more intense high. Some frequently asked questions on prescription drug abuse in teens. How many teens abuse drugs? Among youth ages 12 to 17, 7.7% reported past year non-medical use of prescription medication. According to the 2010 Monitoring the Future survey, prescription and over-the-counter drugs are among the most commonly abused by 12th graders after alcohol, marijuana, and tobacco. The youth who abuse prescription meds are also likely to report abuse of other medication. So where do teens get their prescription drugs? We touched on that a little bit. Majority of the time, they'll get it from their friends, they'll get it from their relatives, oftentimes without their knowledge. And in one survey, 54% of high school seniors said that opioid drugs, other than heroin, so as we mentioned, the Vicodin and the other painkillers, are fairly easy to get. So why do the teens abuse these drugs? Well, they get a high off of the abuse. It helps them to treat pain that they may be dealing with. And sometimes they think it will help them with their schoolwork. Boys and girls will tend to abuse the medications for different reasons. So males are more apt to abuse prescription stimulants to get high, while girls might use them to stay alert. We'll go through some of the physical symptoms and signs that we may see in youth who are abusing prescription medication, starting with the stimulants again, as we had mentioned, the amphetamines and the methylphenidate. You'll find hyperactivity, shaking, sweating, dilated pupils, an irregular or fast heartbeat, seizures. They'll be more paranoid and nervous, repetitive behavior, a loss of appetite. With the sedatives, the benzodiazepines that are oftentimes used for the calming effect and to help with the anxiety, you'll find a loss of coordination, respiratory depression, slower reflexes, slurred speech, and coma. And for the opioid analgesics, what we'll find with that, sleep deprivation, they'll be nodding off while they're sitting down. In this case, their pupils will be pinpointed or constricted as opposed to the dilation that you would have seen in the other medication. Watery or droopy eyes, nausea, vomiting, constipation, slurred speech, constant flu-like symptoms. So again, signs and symptoms to be able to help us detect if and when youth are abusing medication, prescription medication. Some of the behaviors that we'll see in the youth, changes in their behavior specifically, negative attitudes, personality changes, extreme changes in the groups of people that they hang out with or they stay around. They'll start being more forgetful and clumsy. You'll find lying, deceitful behavior. They'll avoid the eye contact. They'll lose interest in their personal appearance and hygiene, lose interest in the extracurricular activities or sports. They'll start eating a lot more, so munchies, find them munching often. Poor performance in school, unusual to what's normal. They try borrowing money, trying to get extra cash. Angry or abusive, they'll start engaging in reckless behavior. And sometimes we'll find them visiting pro-drug websites. We look at the withdrawal symptoms. Taking drugs repeatedly over a period of time can cause changes in the body as well as in the brain. And that will result in physical dependence. And that's different from the addiction. So the body adapts to the presence of the drug, and when it's abruptly stopped, the person can experience these withdrawal symptoms. And this can happen even if somebody's prescribed the medication, which is why oftentimes a physician will taper a patient off of the medication slowly in order not to have them deal with any of these withdrawal symptoms. And of course, the withdrawal symptoms will depend on the drug. So for opioids specifically, they'll find nausea, chills, vomiting, muscle pain, diarrhea. And it can be diminished depending on the proper medical supervision. Next, we'll talk about abuse of over-the-counter meds. And this is where it becomes even more dangerous because these are over-the-counter products that they have access to by walking into a CVS or a Rite Aid or any other pharmacy. They're among the fastest growing types of drugs abused amongst teenagers. They're easy to get. They're easy to find information about, getting high on over the internet. And oftentimes the teens will feel a sense of security because they're legal and they're over the counter and they're accessible. Some interesting statistics on over-the-counter abuse. 56% of teens feel that getting over-the-counter drugs is easier than getting illegal drugs. 40% feel that over-the-counter medication are safer and better to use than illegal drugs. 31 of them agree that over-the-counter and prescription medication is okay once in a while. And 55% of teens don't strongly feel it's risky to use cough medicine to get high. 10% of the teens report that they use cough medicine to get high. So we'll go through some of the over-the-counter products that are actually used by teens. And I'm a pharmacist, and I was actually very surprised at some of the things that I saw. Cough medicine, over-the-counter abuse of cough medicine, things that we're very used to, NyQuil and Robitussin. Teens will take the cough medicine, the dextromethorphan that's found as an active ingredient, can cause mind-altering effects that the teenagers will enjoy. Some of the street names that they use are Robo, Skittles, Triple C, Tussin, or Dex. specific to dextromethorphan. So using this cough medicine, they get a buzz out of it. These feelings become addictive, and the teens find themselves wanting regular fixes of cough medicine. Oftentimes it's difficult to detect that a teenager or a youth are abusing dextromethorphan, again, because it's inexpensive and easy to get, and oftentimes you'll find the signs and symptoms of what we had mentioned earlier. Diet pills are the next category of over-the-counter drug abuse. Overdose, again, can cause that mild buzz that they get that makes them want for more. And as we all know, the diet pills can also point us in the direction of an eating disorder amongst the youth. Laxatives and diuretics, water pills, can also be used and become addictive for teenagers. They want to lose weight, and so they start on these water pills to help them get rid of any excess water that they have in their system, and they can easily become addicted to these medications. Some of the over-the-counter diet pills, Lipofuse and Zenadrin, which we may be familiar with. And then pain relievers, your typical Tylenol and Motrin. Because of the ignorance, oftentimes people think that if I take more than what's allotted and what's recommended by the manufacturer or by the prescriber, I will feel better quicker. And unfortunately, that's not the case. Overdose can very easily lead to death from a drug that all of us find very safe, like Tylenol. Just the right amount in one given day can very easily lead to death. Some additional over-the-counter abuse drugs, pseudoephedrine, also known as Sudafed. We take this to help us with our congestion that oftentimes we'll feel. Same with our youth. It has a similar chemical structure to the amphetamine chemical class. And the ingredients that are used to manufacture Sudafed are the actual ingredients that are used in crystal meth or methamphetamine, which we've heard about in our previous meetings. Bath salts are another one. Bath salts used to just put in a bathtub. Street names of those are Ivory Wave, Vanilla Sky, Purple Wave, and Bliss. And the signs and the symptoms of abuse of bath salts, we find agitation, paranoia, hallucinations, chest pain, suicidal attempts, increased blood pressure, and an increase in pulse. And Benadryl will again also be used to help give them that buzz. I did want to share, I went online and just did a little bit of search about getting high on over-the-counter medication. And I found a forum, a very open forum of some youth discussing, one asking, how can I get high on over-the-counter drugs? I need it for a paper that I'm writing for school. And all of the experts in the previous abusers or regular abusers gave them tips on what to use and which ones will give you the same high as the illegal drugs and how to do it and where to get it and how cheap and inexpensive they are. And I was afraid about all the information that are at the fingertips of these youth. Again, you're looking at junior high up that can have access to this, if not younger. And that concludes the portion we have here on prescription drug abuse. Thank you.